Hello again. Today I would like to answer a question which is important for dentists and also for patients. Like in this case, the patient had a defective ceramic veneering on a widespan bridge. So 4 veneerings fractured and didn't look good anymore. Now the question is, can it be repaired durably so that it lasts over a long time? And the answer is yes. You can have a repair which is long lasting using adequate methods. So first of all, the dentist needs to know adequate conditioning methods for the bridge. Here in this case, metal was uncovered and veneering ceramic in part. So these two substrates need to be conditioned differently. So as you can see here on the picture on the bottom, we used intraoral hydrofluoric acid etching, and the etchant needs to be neutralized then with a gel, which is here this violet color, and then it's rinsed off, and the ceramic needs to be also conditioned then later on with a silane, while the metal needed to be silica coated and then silanated. And so the dentist need to know which method is adequate, and then the veneers you can see on the upper photo on the right side, which was produced from a medium strength ceramic, which is 4 times stronger than usual veneering ceramics like feldspathic ceramic, was used to produce the veneers. The veneers were bonded into place, and that gave a long-lasting repair. Patient was quite happy that not all the crowns had to be removed and the whole bridge had to be remade. So with this repair, the patient saves time and money, of course, and also it is much less invasive for the abutment teeth because there is no anesthesia needed and no new impression with retraction cords and so on, new provisionals and all these things. So it's a good idea to think about to repair an existing bridge which had some fractures at the veneer of the veneering ceramics instead of replacing the bridges as a whole part. It saves a lot of money and time. I hope this information was helpful, and I wish you all the best. See you next time. Bye now.